In this module, we are going to discuss learning disabilities and attention deficit disorder, both with and without hyperactivity, and how we go about qualifying students with these disabilities. Let's look at the options for identifying students with specific learning disability. Prior to 2004, the only method for qualifying students with specific learning disability was the discrepancy model. In this model, the student needed to exhibit a pattern of strengths and weaknesses in performance, achievement, or both, relative to their intellectual development. In 2004, IDEA was reauthorized and provided options for identifying students. The discrepancy formula may be changed to response to research-proven effective intervention, which has been shortened to response to intervention. In this method, the child fails to achieve a rate of learning to make sufficient progress to meet state-approved results in one or more of the areas identified when assessed with a response to scientific research-based intervention process. Data needs to be collected at least weekly to support this decision. Districts may choose to retain the discrepancy formula, discard the formula altogether, or use a combination of the two. Prior to the referral process, the child should be provided appropriate, high-quality, research-based instruction in regular education settings by qualified personnel. Database documentation of repeated assessments of achievement at reasonable intervals needs to be collected. A student assistance team is now required in all schools, and the team and teacher must collect the data to support their decisions. If the child has not made adequate progress after an appropriate period of time, a referral to the student assistance team should be made. 30 days is usually considered the appropriate period of time. Any formal assessment and the data collected needs to be provided to the parents and presented to the student assistance team if a referral is made. The process of using research-based instruction and documenting the child's progress is known as response to intervention. It is the practice of providing high-quality instruction and interventions matched to the student's needs. Monitoring progress frequently to make decisions about changes to instruction or goals is a part of this process. Applying child response data to important educational decisions is a must. Assistive technology can be an intervention under response to intervention. If the child does not make progress, which is documented with repeated assessments, the student assistance team can either suggest a different intervention to try and collect additional documentation, or make a referral to the multidisciplinary team for an evaluation to identify a learning disability. Once the referral is made, the child must meet the criteria to receive a handicapping label of specific learning disability. Let's look at the federal definition for specific learning disability. It states the child does not achieve commensurate with the child's age in one or more of the areas listed below when provided with learning experiences appropriate for the child's age. Those areas are oral expression, listening comprehension, mathematics calculation, written expression, mathematics reasoning, basic reading skill, and reading comprehension. The discrepancy between where the child should be and where the child is functioning must not primarily be the result of a visual, hearing, or motor impairment, a mental disability, emotional disturbance, cultural factors, or environmental or economic disadvantage. These 5 areas need to be ruled out as the main cause for the learning deficit in order to qualify for special services. The discrepancy model has 3 main criteria in the state of Nebraska. First, the student needs to score above 1 standard deviation below the mean on full-scale IQ, which means the IQ needs to be greater than 85. Second, the standard score in one or more major areas must be at least 1.3 standard deviations below their ability level, or the academics scores need to be 20 points lower than their IQ score. This last criteria is unique to Nebraska and not universal across the United States. This one states that the standard score in the identified area or the academic areas shall fall at or below 90 standard score points. Standard scores must be used. Age or grade equivalents cannot be used to determine discrepancy. Let's look at the discrepancy formula from the point of view of a normal distribution of bell curve. If a child has an IQ of 100, or in the mean, his academic scores must be 80, which is 20 points less, or less to qualify with a specific learning disability. However, if a child has an IQ of 120, the 20-point discrepancy rule would not apply because the academic scores must be below a 90. To qualify, this student's academic scores must fall below 90, which would make a discrepancy of 30 points or more. The problem with using the discrepancy model alone is twofold. Many struggling students do not have the required 20-point discrepancy and therefore would not qualify, especially those with IQs in the 80s. Also, many twice exceptional students or those with learning disabilities and giftedness do not qualify because their academic scores may be 1 or 2 points above the cutoff score of 90. The solution to this, that most districts are using a combination of the discrepancy model and response to intervention. A comprehensive special education evaluation is conducted, as well as the response to intervention data is used to support or refute the evaluation results. For instance, the child has an 18-point discrepancy, but the RTI data indicates a lack of progress. The child can now qualify for services. Now let's look at attention deficit disorder, both with or without hyperactivity. In the 1990 reauthorization of IDEA, attention deficit disorder became a subgroup of other health impaired. If a child has a medical documentation of attention deficit disorder with or without hyperactivity and does not qualify with a learning disability, they can now qualify for services under the other health impaired label. Students with learning disabilities and attention deficit disorder have a common bond. They all struggle with academics and have some common characteristics as shown on this slide. Distractibility unlike their peers, excessive movement indicating hyperactivity, inattentiveness, impulsiveness, inability to solve problems. They may have deficits in motor coordination, spatial relation, active involvement, motivation, language skills, social skills. They may have learned helplessness and disorganized approach to learning. It is my opinion that learned helplessness and the student's diagnosed disorganized approach to learning are the two characteristics that impact success in the general education classroom the most.